Hey, if you're a parent, especially of a little boy, chances are you've heard the word phimosis, or at least have had some questions about the foreskin. It's a super common condition, but man, it's also a source of a lot of confusion and frankly, a lot of anxiety. Our whole goal here is to cut through that noise with clear, evidence-based info.
So let's just jump right into the big question, right? Is it a problem if the foreskin can't be pulled back? Well, the honest answer is it depends. And that's exactly what we're going to unpack, figuring out what's just a normal part of development versus what might be a sign that you need to check in with a doctor.
Here's our game plan. We'll start with the basics, what is phimosis, then we'll get into the most critical part, the difference between the two main types. After that, we'll look at what causes it, how doctors grade it, the latest treatment guidelines, and finally, some really important warnings you need to know about.
All right, let's start with section 1 and just lay a solid foundation. What are we actually talking about when we use the word phimosis?
Simply put, phimosis just means you can't pull the foreskin back over the head of the penis. But here's a cool little tidbit. The word itself comes from the Greek phimos, which means to muzzle. And honestly, that's a pretty vivid and accurate picture of what's happening, isn't it?
Now we're at what is, without a doubt, the most important takeaway from this whole thing. Not all phimosis is a medical problem. Getting the difference between what's normal and what's not is absolutely crucial to avoid unnecessary stress and, more importantly, unnecessary treatment. So think of it this way. On one side, you have physiological phimosis. This is the normal kind that almost all baby boys are born with. It's just because of natural attachments that are supposed to be there. But on the other side, you have pathological phimosis. This is the acquired type, meaning it develops later in life, usually because of a problem like scarring or inflammation. The key difference? One almost always gets better on its own, while the other often needs a doctor's help.
And this chart just illustrates that point perfectly. I mean, look at these numbers. At birth, only about 4 to 5% of newborn boys have a retractable foreskin. But by their first birthday, boom, that jumps to 50%. By age 3, we're at 90%. And by the late teens, it's nearly everybody. This is really powerful data that should bring a lot of peace of mind to new parents.
So we see it's normal for kids, but what about adults? Here we're shifting gears to talk specifically about pathological phimosis. For uncircumcised adult men, the prevalence is estimated to be somewhere between 0.5% and 13%. So this shows that while the vast majority of childhood cases just resolve on their own, a small but real number of men do develop this as a true medical issue later on.
So if it's not just a normal part of development, what actually causes this pathological form of phimosis to happen? And how do doctors figure out how serious it is? Let's get into the details on that.
Well, there are a few main culprits. A common one is a chronic skin condition called BXO, which basically creates scar tissue that tightens everything up. But another huge cause, and this is so important for parents to hear, is trauma from trying to force the foreskin back before it's ready. This creates tiny little tears that heal into scars, and just like that, you've turned a normal condition into a pathological one. Other things like diabetes or poor hygiene can also contribute by causing repeated inflammation.
To make sure everyone's on the same page and speaking the same language, clinicians use a standardized scale to grade just how severe the phimosis is. The one you'll see most often is called the Kikaros classification.
And this diagram here lays it out beautifully. Grade 0 is completely normal, fully retractable. As you move up the scale, it gets more and more limited. By grade 3, you can only see the opening for urine, and by the time you hit grade 5, there's no retraction possible at all. This scale gives doctors a really clear, objective way to measure the condition and track whether or not a treatment is working.
Okay, so we know what it is, we know how it's graded. So what's the modern way to treat it? Well, let's take a look at a set of official medical guidelines, in this case from the Indonesian Urological Association, which really reflect a common worldwide standard of care.
The guidelines recommend this really clear step-by-step process. The first thing they always try, the go-to for primary phimosis, is conservative therapy. This usually means applying a mild steroid cream for a few weeks. And you know what? It has an incredible success rate, over 80%. Surgery, like circumcision, is really reserved as a second option, only if the cream doesn't work or if it's clearly a pathological case caused by scarring or constant infections.
And yes, we are showing you this again because it absolutely has to be said one more time. This is the single most important piece of advice for any parent or caregiver. Never try to force the foreskin back. It is the #1 preventable cause of turning a completely normal part of childhood into a lifelong medical problem. Gentle cleaning on the outside is all that's ever needed.
So what happens if pathological phimosis is just left alone and not treated? While it's not always an emergency, it can definitely lead to some pretty significant complications that are important to know about.
The risks you run with untreated pathological phimosis can range from just being uncomfortable to some serious medical stuff. We're talking about things like recurrent UTIs, painful inflammation of the head and foreskin, that's balanitis and posthitis, and even problems with urinating, where the foreskin kind of balloons up. But one complication stands out as a true bona fide urological emergency.
And that emergency is called paraphimosis. This is when the foreskin gets pulled back behind the head of the penis, and then it gets stuck there. It acts like a tight band, causing the head to swell up, which makes it even harder to pull the foreskin forward. It's incredibly painful and can actually cut off blood flow, which can lead to tissue damage. If this ever happens, it requires immediate medical attention, no waiting.
So let's wrap this all up with this quote, which just perfectly captures the main point we've been hitting on. Accurate distinction between normal and pathological phimosis is key to avoiding unnecessary surgery. Getting this one thing right prevents so much needless anxiety for parents and protects kids from procedures they just don't need.
And this brings us to our final, most practical takeaway. When should you actually worry? The key red flags are any signs of pain, swelling, redness, discharge, or any trouble at all with urination. If you or your child has any of these symptoms, the answer is simple. Don't guess and don't wait. See a doctor, get a proper diagnosis, and get the right advice for your specific situation.